questions.
And Sandra, you in your opening remarks, you seem to suggest that a kind of lack of clarity in the area that you're working in about public health messaging and so on. So what would be the sort of, because we're into practical recommendation territory, what would be the one recommendation that you'd want from government in order to address fetal alcohol syndrome?
Well, I would say don't ask me the question. Go back and look at the hundreds and hundreds of hours that have already been done by people in the Department of Health, in NICE, in SIGN, in Public Health England, now OHID. You're sitting here for the first time with every major public health body now saying that there needs to be improvement and there needs to be more attention to this. So what I would suggest needs to be done is that there needs to be a green paper on how the implementation of the Department of Health FASD Health Needs Assessment is going. That would lead to an FASD Prevention and Response Act. I think there needs to be an FASD Prevention and Response Fund that should equal at least 0.1%, if not 0.2%, of the alcohol duty. Because let's be real about it. We're sitting here, and I'm here as a mom too. It's hard when you're in this kind of a place to portray the reality of lives of people all across the country. But if we're here in a hearing talking about prevention of harm from alcohol, and if those people whose lives and futures are affected by alcohol before they take their first breath or see this world aren't top on the agenda for every single person in this room, then I don't know what we're doing here. And like I said, for now, there's a way forward because there's been that hundreds and hundreds of hours of investment. And so I would say that that's the most important thing. I think that when it comes to the messaging around the use of alcohol in pregnancy, we need to separate it out from this alcohol harm. That was the problem with it. When the chief medical officers changed their guidance after all those years to say that there's no safe time, it's safest to avoid alcohol in pregnancy, it was buried in with these other guidelines, and it led to confusion, and it led to it being not considered as important, and including by industry, including by other alcohol harm groups, including by policymakers. And I just think, you're talking about something that has the same, it's a teratogen, it's a poison. It does what thalidomide did. It does what some other things do. We've come out more strongly on other kinds of teratogens, but we haven't done it for alcohol. And it's time. It's time to make sure that people who, we focus on trying to get the data, rightly so, from those, even in the NICE quality standard, it says when you come in for your maternity, your first check that you're asked about it, and you're asked about it throughout pregnancy. But what about before people get pregnant? What about getting it out there so young people understand before they're thinking of pregnancy that it's not safe to have alcohol? I think that there should be, I didn't name it, but I like the name. In Ontario, there's something called Sandy's Law, where they have posters up at point of sale, not just the little tiny, industry has done a good job in getting the little thing on the X'd out woman on the label, and that's been voluntary, that's working, but it's not enough. There's other countries have stronger labeling where they put words in there and they use colors. There's a way to not X out the woman. As a woman, I really dislike that. There's a way to do an empowering image on there. There's ways for the industry to make this a priority and to be promoting truly zero alcohol-free mocktails. They've got the PR machines. There's a lot that can be done, but primarily and most importantly, and I thank you for having me here today, is separating this out and making it an issue. Because if you are looking for a place as a committee, when you are looking at prevention, a place where you can have the most profound impact on the future health of this society, there are more people with FASD than autism right now. That's a fact. Wow. What are we doing about it?
Wow, interesting. Well, thank you for that.
It's a really interesting fact, isn't it? So, Sandy's Law, Ontario, Canada. In Canada, Ontario, Canada,
Yeah. I can send. I'm happy to send.
What do you think, Mr. Lambert? To the point made to your right, labelling, marketing. So, do you know about Sandy's Law?
I do, and Sandra and I have spoken about it even recently. But I think the numbers, the facts that Sandra tells us are absolutely shocking, aren't they? And we are absolutely clear alcohol and pregnancy do not mix, and people have to be careful if they're
Is there more you could do to help what Sandra just said?
Well, I appreciate what she said about...
Because you can make recommendations to us, and we'll
I appreciate what she said about
to you, but she's sitting next to you. I mean, it's
indeed,
amazing.
yeah. And I feel it as anybody would, but as a parent. But first of all, I appreciate what she said about the labelling, and I completely, that's at 99, effectively 100% of products carrying that. I'm perfectly willing to look at what the label says and looks like in terms of what Sandra said about that. As regards Sandy's law, I'd need to look at that more closely, but I think in principle I would support, and again, this is for the outlets, and Andy can tell you more about that, but in principle I would be supportive of more information at point of sale, point of purchase, that people are aware of these issues. It's a terrible thing, and it needs to be prevented.
I like this. It's like direct recommendations. We're not going via the minister and the select committee. We're just on the panel. I mean, if you weren't here,
I don't have any power over pubs and bars and restaurants. By the way, I can only encourage. But
Sandra's perfectly placed between Andy and Matt.
I think it's also important for you as a committee to invite in the Secretary of State and ask what's being done to follow up on the FASD health needs assessment. There's been a lot of people power out there throughout the systems, and what we need is for the Department of Health FASD health needs assessment and the NICE quality standard, and we need it all to be operationalized.
It's funny you should say that, Sandra. We were discussing just before you came in, the Secretary of State. I assure you that has not crossed. That has not.
Please
a point
be sure
missed
to ask
on
this question.
She will be coming back.
Thank you.
Right. Anyway, let's bring in Rachel Mascor next.